Hello, and welcome to another segment of the East Brunswick Advisory Health Council's Wellness Spotlight. A new virus is causing quite a stir. First detected in people in April 2009 in the U.S., it has appeared in other countries, including Mexico and Canada, spreading from person to person in a way that regular seasonal influenza viruses typically spread. American health officials declared a public health emergency as cases of this strain of flu, previously known as the swine flu and now called H1N1, were confirmed in the U.S. Many health officials across the world have expressed concerns of a global pandemic emerging from Mexico. Several nations have imposed travel bans or made plans to quarantine air travelers that present symptoms of H1N1, despite the fact that the World Health Organization now openly states that it's not possible to contain the spread of this infection and recommends mitigation measures, not restricting travel or closing borders. Media coverage of H1N1 has ranged from basic health news to the panic of a critical alert. To separate help from hype and provide you with the information you need to make informed decisions, I'm honored to have as my special guests Austin C. Kosik Jr., a certified emergency manager and the emergency management coordinator for East Brunswick Township, and Dr. Madhavi Ponnapalli, a medical doctor and specialist in infectious diseases and internal medicine with Highland Park Medical Associates on Cranberry Road in East Brunswick. Dr. Ponnapalli, Mr. Kosik, welcome to the Wellness Spotlight.
Thank you.
It's a pleasure to have you here. Dr. Ponnapalli, let's begin with you. Tell us, what is the flu? We've been hearing so much about it these days, especially the swine flu, now called the H1N1 virus. Can you tell our viewers a little bit about it?
Well, influenza, which, as we have all heard, is a seasonal disease we usually see between the months of October and March, is a viral illness. And essentially it presents with people having upper respiratory symptoms like cough and runny nose and sore throat, sometimes a headache and high fevers, body aches, and sometimes nausea and vomiting. Now, the H1N1 virus, which is what's called swine flu, is a very similar virus with a very similar presentation. It's just that the virus incubated in the pig and is a combination of three different viruses. And whereas before it was transmitted from pig to human and they were isolated cases, in this situation we've been seeing human-to-human transmission, which is why it's become such a public health concern.
Now, has your practice seen any cases in East Brunswick yet?
We've not seen any cases here. We've had some suspicious patients, but they've not been positive.
Typically, the flu season is towards the end of the year, around September, October, right. November.
Yes.
Why is it that we're hearing, well, we're taping this now in the springtime? Isn't that a little unusual?
Well, influenza season's actually worldwide all the time. It's just that we happen to get our cases in the winter here, but you know, in certain parts of the areas, you will see influenza all year round. It's just that, again, in this situation, because of the human-to-human transmission and the rapid transmission, we're seeing a lot of influenza cases at this time of year.
I understand. And we originally, about a week ago, we were hearing a lot in the media about it, and there were words like pandemic being used, and there was a lot of fear out there. People were very upset. These days, we're really not seeing or hearing much about it at all. Why is that?
Well, initially, when we started seeing cases, they were coming out of Mexico. There seemed to be a lot of deaths associated with the infection. Mexican authorities initially didn't have all the confirmatory evidence to say that this was or was not swine flu. Subsequently, we had travelers, and a lot of cases worldwide are being seen because of travelers, because it's become such a small world and people travel so frequently. Transmission of infections occurs more quickly now. So again, we saw cases within a week from Mexico. We saw cases in Texas, California, and then we started seeing them in New York. Now there's Australia, Poland, Germany. So the concern was because of travelers, because of the fact that this infection was being transmitted so quickly from person to person, and the death count in Mexico, which has not been borne out here, thankfully.
Why do you suppose it started in Mexico, of all places?
just happened to be where the virus mutated. Influenza viruses are mutating all the time. As you know, we need to have a vaccine every year, and a new vaccine is made every year based on what viruses are circulating during that year. And every year you see mutations in the different viruses. So because of that, you just happen to have a couple of viruses that mutated at the right time, in the right host, and spread to the right people that then spread it. It was just happenstance, unfortunately.
So what are some of the things that you recommend to your patients to be able to take good care of yourself? And if you have the flu, what are some things that you could do to be able to get rid of it as soon as possible?
It depends on what kind of host you are. Generally, if you're a healthy person, the chances of you getting this infection, clearing the infection, and not being affected by it are pretty good. Young children, people over 65, people with chronic health conditions, heart conditions, lung conditions, they're the ones at higher risk of having problems from this infection. So those are the people that we usually vaccinate in September, October, before influenza season anyway. But in this situation, the best way to protect yourself is really just, if people are sick, try to avoid them. If you are sick, when you cough, you cough and sneeze into your hand. You wash your hands afterward. You can use the alcohol gel to wipe your hands as well, the sanitizer, and just take care of yourself. If you're ill, stay home. Don't go to work. Don't go to school until you're better. That's the best way to protect yourself and protect other people.
I see. And how would somebody know whether or not they have the flu?
The symptoms I mentioned earlier, if you have high fevers, body aches, sore throat, runny nose, headache, cough, those are really the big symptoms. Now, a lot of viruses can present that way, so it's not always influenza just because you have those symptoms. That's why you have to see your physician and have a test done.
One of the most common self-help tips that we've heard about in the media is that people are asked to wash their hands a lot.
Right.
Is there a certain special way that you should wash your hands to be able to protect you better than the way you just normally would?
Well, you wash your hands you take soap, you wash your hands for about 15 seconds, before you put it under water. A lot of people, what they will do is they'll just take the soap, wash their hands under running water, and walk away from the sink. Here, you really need to wash your hands before you put it under the water. Wash your hands thoroughly, both sides, then for at least 15 seconds, then put it under water, rinse them off, and then turn off the tap.
Now, aside from washing your hands, you had mentioned before about immunization. There's a growing public concern about the efficacy and safety of being immunized, that many of these shots contain mercury, and there are side effects. Some of these effects from immunization can be death. I know death is a possible side effect from Tamiflu. The Japanese government had banned it. What are your feelings about that?
I think in the right population, the risk of immunization is much lower than the risk of complications of the infection, and that's generally why we immunize. The mercury and, the risk of death, we give out 600 flu vaccines a year. Nobody dies of getting the vaccine. But people who are over 65 and young children, the chances of having post-influenza pneumonia, the chance of just being extremely ill, requiring hospitalization, it's so much higher risk of complications that the risk of the vaccine is minuscule in comparison.
But there are some people who say they didn't have the flu until they got vaccinated, and then they came down with symptoms. That's
true, and yes, people tell me that as well. In those situations, the vaccine is not a must. It's a healthcare guideline, and it's something I tell my patients is something that they should have. But if they feel strongly that they don't want it, it's not something that I will force on them. So the bottom line is, the better you take care of yourself and the healthier you are, the less likely you are to be able to come down with something. And if you do, the quicker you'll be able to respond and heal. That's right. Thanks, Dr. Ponnapalli. You're welcome. Mr. Kosik. Yes. You are a certified emergency manager, and you're also the emergency management coordinator for the Township of East Brunswick. That's a mouthful. Yes. What does that mean exactly? Well, in emergency management, our responsibility is to keep an emergency operation plan for the township in the event there's an emergency that's above and beyond the normal day-to-day accidents
small type emergencies, when we get into bigger disasters, widespread incidents, the Office of Emergency Management has a plan that brings all the agencies together to get the emergency to a mitigated position, everything's calmed, and getting the town back to normal operation. For this specific public health crisis, once the federal government issued the public health warning, the Office of Emergency Management now has a plan that's an all-hazards approach, and we also have specific plans for certain type of events. Obviously, the pandemic possibility that was going to exist, we have a plan that in the need that we needed to get vaccinations out to the public, our plan would be coordinated through emergency management, and would be able to get that out to the citizens of East Brunswick.
And how is that information disseminated, Mr. Kosik?
Well, fortunately, through the really great works of EBTV, we reach a lot of households that way. We have the ability to call each household through a calling system from a company called Global Connect, and also through just press information to get the word out there. The goal for emergency management is to get accurate information out and to have the public aware and to give them knowledge of the emergency that's either taking place or that may take place. As you mentioned earlier, that last week there was a lot of hype and a lot of uncertainty of what was going on, and we took our plan, addressed the needs that we felt the community needed for it, and got the information out through slides on EBTV, through just publications. Had several meetings with the mayor's office, the school Board of Education superintendent's office. We did a message to each parent on a phone system, and we also sent out a joint letter to the students to indicate what the community is doing and what the school students need to do and the teachers need to do in the event they start receiving some of these symptoms to stop the spread if this virus was to get into our school system or into our community.
So right now, we're taping this, it's the spring of 2009. Do the residents of East Brunswick have any cause for concern or alarm at this point?
Not at all. This is again, awareness and knowledge-based information to get out to people. There's no confirmed cases of H1N1 in East Brunswick. We receive updates in emergency management daily, and if there's an immediate threat or immediate cause for an alarm, we receive that immediately, and then again, our plan would get out to the residents. We're aware of it. We're working on it continuous, and there's no need at all to be alarmed, none whatsoever.
That's great. Do you have any suggestions for our viewers on what they can do to be able to take better care of themselves?
I mean, exactly what the doctor just said. The only thing I like to add, the 15 seconds, I've been getting a lot of calls, people calling. I just tell people, while you wash your hands, sing happy birthday to yourself. You're going to get your 15 seconds in. If they can sing happy birthday, you're going to get it in. So that's what I tell the people. And the cause for alarm of people that were saying, hey, we have a problem here, why is everybody jumping to this conclusion? And the best way I can put it, because this is new to this area of a public health emergency, is continuously in the summer, early fall, we hear of hurricanes out in the Atlantic. We have a big hurricane, Hurricane Adam. Where's it going? Well, it may go to Long Beach Island. So we get ready in case this hurricane may come in. We may have to evacuate. We may have to, make provisions for power. And then all of a sudden, what happens? It veers off to the right or to the left, and we get a couple of showers, and everything is fine. That's how this crisis unfolded. We were prepared for that onslaught of a lot of people getting sick. We had, our plan together to get vaccination, and not vaccination, wasn't available, to get medication out, to make arrangements for surge into the hospitals. And fortunately, this thing has quieted down as of today. One of the things that is good for the public to know is keep an eye on the EBTV for our slides that show, because we refer to certain websites. I mean, as of the taping today on May 8th, there's a website that came out specifically for graduations in colleges and universities. There were some concerns about those. So the CDC, Center for Disease Control, looked at that and they came out with a protocol. And we get that information, we clear it out, and get it out to the public.
Okay.
That's what we do.
Thank you. Dr. Ponnapalli, what is it that the residents of East Brunswick don't know about the flu and taking care of themselves that you'd like to share?
I mean, I think at this point we've gone over most of the basic symptoms and the people who are at risk in the population. The only other thing I would say is that there is a treatment out there, and there's nothing to be alarmed about. That this is, I mean, so far the cases that we've seen in this country have been mild. Many have not required hospitalization, and this is in some cases to be considered just like a normal influenza season. It just came a little early, but doesn't require panic on the part of the public.
Now, in addition to taking good care of yourself, it's also important to be able to take care of your surroundings, because the virus can be transferred to people who have a lowered resistance by coughing, sneezing, shaking hands,
Yes.
and also touching objects that people who are infected have touched. I don't know who would be the right person to ask this question to. It's open to either one of you. How should people take care of their homes? How should they clean them to be able to protect themselves and their family?
Just whatever they've been doing so far. It's really going to be up to the sick person. If somebody is ill, you know, before you touch a doorknob, a lot of this is doorknob, countertops, things like that. Don't share utensils. Don't share, dishes when you're eating if somebody is sick. Those are just basic hygiene that we do whenever anybody gets any kind of virus. I wouldn't do anything different than that. The only other thing I would add is, you know, even if you feel like you're sick but you can go to work, I would say, look, you know, stay home, get better first so you don't infect people at work. You don't always know what the people around you, what their medical problems are, if someone's immunosuppressed or not. So it's safer to stay home than to go out there and expose other people, number one. And if you're an employer and your employee calls in sick, you know, be understanding of it. It's a public health issue again. You don't want your other employees to get ill. It'll cost you more in the long run than allowing somebody to be out sick for a couple of days.
Excellent.
One of the things that I think this incident has brought up to people in terms of knowledge and awareness is, if you lose a few employees in your business, how are you going to continue your business to run? You need to take a look at critical positions, a business continuity plan. So if you lose a certain person, is your business shut down because one person is out? And earlier on, you wouldn't even have to have been sick to be out of work, because the initial CDC plan for schools were if there was one confirmed case, they were completely shutting the whole school down. That was the recommendation from the CDC. So just imagine having to have to shut a school down that has 600 children. Those parents are now going to have to stay home to take care of those children. And it just starts a snowball effect of businesses losing personnel. So this might be a time for business owners to look and say, what would we do if I lost some key people? And are we layered? Do we have backups that can do this? Can we work remotely from home to get our business to continue to go? Because you may not physically have the illness, but yet your business can have effect of it for a reason that is really not because of the illness.
Thank you, Mr. Kosik. Thank you, Dr. Ponnapalli. Thank you so much for what you both do to be able to protect our community and help make it a healthier place in which to live.
Thank you.
Thank you.
This concludes another segment of the East Brunswick Advisory Health Council's Wellness Spotlight. I'm Dr. Ken Friedman, President of the East Brunswick Advisory Health Council. For those of you that would like additional lifestyle-based information that would help you improve your level of wellness and also increase your resistance to the flu as well as other diseases, you can feel welcome to email me at ken@friedmanchiropracticcenter.com. Remember, wellness works when you work it.